I'm going to be trying the new GeekyMedics AI history taking tool. Basically, you're going to be taking history from an AI. I'll be giving it a try, and hopefully I'll be also trying to explain why I'm asking the questions I'm asking while I'm taking history. I'm not sure which one to choose. Let's go with the difficulty swallowing. Let's try again. Tree, and difficulty swallowing. Okay, so I'm gonna be clicking on virtual patient, and that'll take me to the AI thing. I'll click the enter station, and let's get started. So you're just supposed to ask the patient. So I'm gonna be like, "Hi, I'm Dr. Madan. How can I help you?" See what they'll say. Okay, so they gave me the duration, so I'm gonna be asking about severity, or is it for solids or liquids? Okay, so it's progressive. We're gonna ask about weight loss because it'll help us see the severity. Okay, there's weight loss as well. So we're gonna go towards, we've already assessed the severity. We assessed the onset because it's gradual. First solids, then liquids. We've also assessed the severity with weight loss. Duration is about 4 months. So this is something more severe, something more gradual. And so we need to ask about age. Okay, this is a 65-year-old. And they're female. Sorry, it was already mentioned that she's a female, but I forgot. So this is a 65-year-old female. Do you smoke? I'm taking this focused history here, not something that is as much, but she's an ex-smoker, and that is a risk factor for esophageal carcinoma, as you know. So it's probably something that's malignant, maybe. We can ask about vomiting. Maybe if there's blood in her saliva or anything, nothing. Thinking of, honestly, it's been a while since I've last taken a history. So I'm thinking of, she's got weight loss. You asked about one of the risk factors. You should ask about other risk factors. Okay, so she's a drinker. She's also a smoker for 40 years. And yeah, they're having... Okay, so what else can we ask? With vascular severity, we can ask about how it's... Okay, so they also have food that gets stuck. They end up regurgitating it. That's more going again with that there's something physical that's blocking the pass or flow of food. It's nothing nothing mechanical, nothing nervous, like for example diffuse esophageal spasm or achalasia or something along those lines. Ask if there's anything else associated with it. Okay, there's a history of reflux. And that's very important. I forgot to ask, but there's also a history of reflux. That's chronic irritation. It can be one of the causes. This can help us kind of note down the location. Okay, so it's difficulty in swallowing throughout the process, not in the beginning. or in the end. So it's not like achalasia where it ends at the end of the stomach. Nothing like probably in the like pharynx or like something up. So that's some form of explanation as well. I'm going to go into drug history. I'm going to go into actually past medical. No, there's nothing else on any other system I want to ask about. Actually, I'm going to ask about chest pain just in case. I'm going to ask about blood and stool. Just the big ones. No vomiting, no diarrhea, no bloating, no blood and stool. These things are just like regular. Any yellow skin. We're just looking for other things, just quickly looking around. Any abdominal pain. Just quickly reviewing on the abdominal GIT system, then we can go quickly towards like other systems such as CNS. We can just ask about, I'm not going to ask about the other systems, mostly because I think they're not as relevant here. We could ask about history of cancer. Okay, so there's no family history at all to be able to tell. And let's ask about surgery. No surgeries. Do you have any chronic medication? Do you have any chronic illnesses? Good, and hypertension. If there's, can you check about like, are you on any chronic medication? Either on any long-term medication. Okay, she's on amlodipine and she's on antacids. You allergic? And that's actually a very important question to ask. It's not going to help us right now in diagnosis, but it's important. We need to ask about and a quick tap onto their social history. She's working as a teacher. Any voice changes? Just quickly, just to. That's just asking because when teachers, they could have like other like issues, for example, in the epiglottis and so on. And we'll check for the diagnosis, which I'm thinking is going to be esophageal carcinoma. Yeah, so it's esophageal cancer. And we can take a quick look at the patient's script to see what else we're supposed to see. We're supposed to see that it was gradual onset to liquids, that the symptoms are constant, they don't come and go. I think I forgot to ask about this one because we should have asked it. Because, for example, achalasia comes and goes. Regurgitation is important. Weight loss, we've already asked. I did not ask about appetite. We should have asked straight after weight loss to make sure that the appetite issues or the weight loss issue is related to the specific symptom and not to appetite problems. Reflux, appetite also, anorexia is also a symptom of cancer. Halitosis is also very important to ask for, where we should have asked about bad smelling breath, because that is sometimes common with, like, for example, if there's a pharyngeal pouch where food gets stuck and it ferments and it becomes really bad smelling. The rest of the things we've asked, we should have asked about neurological symptoms because bulbar systems, so for example, the glossopharyngeal nerve, palsy can be causing the regurgitation and the difficulty in swallowing. So in the systems, I should have asked about neurological just really quickly. ICE is very important with real patients. This is not a real patient, so that's why I didn't ask about them. Past medical history were good. Drug history were good. Social history. Smoking and the drinking we asked. We didn't ask about the drug use. We could have also asked about how it's affecting her daily life because this is something chronic that's been going on for like a whole 4 months. And family history, we asked about it. So good job. I think I managed to actually get to the diagnosis, although my history has been a little bit rusty. And overall, I really like this AI thing. Just generally giving feedback on the AI itself. I really like the way it works. It is very specific. I think maybe it could, although I'm not sure if that works with AI or not, but I think that it might be over volunteering information. Like, for example, where specifically feel like I asked something and it gave me a bit too much of what I've been asking for. Yeah, like for example here, when I asked if it's a solid or liquids, it immediately gave me the fact that it was progressing. I feel like maybe that's a bit too over volunteering, but also that's actually very realistic. I guess a patient would be able to do that. This is definitely a great place or a great tool to practice if you're nervous when it comes to interacting with real patients. If you are like me, currently not working, you don't have the time or like the ability to go to the hospital. And if you don't want to, like, forget all about history taking, this was such a nice refresher for me. I definitely recommend the GeekyMedics AI history taking tool. It's absolutely lovely. Thank you so much for watching. And if you want me to do another one on any other systems, please do comment below.